We are back with Dr. Joseph Kafuuma, a fertility doctor at Women's Hospital International and Fertility Center, Bukoto. Welcome to the show, Dr. Joseph.
Thank you very much.
What are the factors that reduce fertility or chances of conception in both men and women?
Well, thank you very much. Thank you for hosting me on this program, the Bump Love Show. Yeah, my name is Joseph Kafuuma. I work with Women's Hospital International and Fertility Center, Bukoto. To go on the question, for any couple that is trying to conceive, what they should know. In the first month of staying together and trying, about 30% of couples will conceive. Then by the 6th month, we expect 60% of couples to have conceived. Then by the end of the year, 12 months, about 90% of all couples would have conceived. Then by the 18th month, or let's say 2 years, end of 2 years, 95% of couples. So you see in the second month, chances, because that's a cumulative, conception rate. Yeah, so about 5% by the second month.
Second year.
Yeah, so if you don't conceive in the first year, that means your chances of conceiving reduce markedly. Yeah, so things that might reduce conception in any couple, age is a major factor. Below 35, higher chances. The young the couple or the young the lady, on the lady's side mostly, age. Yeah, so below 30, higher chances. Below 35, between 30 and 35, yeah, chances are still good. Above 35, above 35, chances become slim. Yeah, as you approach 50. Yeah, 40, 50. Yeah. So other things that can reduce the chances include smoking. You might not be the one smoking, but if you're near people who smoke, you're a passive smoker, so you can be affected. Then drinking alcohol can also affect. So people who overdrink, abuse. Drinking is okay, but there is that level of abusing. Yes. Yeah, so that can also affect. Caffeine, people who take in too much caffeine. Coffee. Yeah, coffee can also affect. Then body weight, underweight, being underweight. You've heard of the body mass index? Yes. Yeah, so below 20, there might be trouble. Yeah, so above 30, that's when you enter into the category of obesity, Yeah, that you may find troubles conceiving. So body weight is an issue. Yes, those are some of the things that really reduce.
So coming from there, let's look at the extreme case, which on this subject is infertility. Please maybe medically define for the purpose of our viewers, define infertility and what the main causes in Uganda are today.
Okay. Yeah, infertility in a couple that have stayed together for a year. The time frame is a year. And they've had regular unprotected sexual intercourse. And then a baby is not coming. Yeah, so such a couple fits into this definition of infertility. Okay. Yeah, so you need not to have used any contraceptive methods, unprotected regular intercourse, then you've tried for a year. So that's when we can say maybe you're infertile.
Okay.
Yeah, so among the causes cut across. A woman can be the wife, the woman in the relationship, or the man, or can be both. Wow. Yeah, there are instances where we find there is an issue with the woman, then there is an issue with the husband. So, yeah, and among the causes in women, in Uganda, the most common cause is to do with tubes, fallopian tubes. Okay. Yeah, and one of the most common causes of tubal blockage is infections. What they call PID. It's a common if you're a lady and you've not heard about PID and you've been in hospital.
I've heard of UTI.
What's
I've
PID?
not heard of PID.
Yeah, PID is pelvic inflammatory disease. UTI is something else, and many people confuse UTI because there are two systems down there. There is the urinary system, which is not connected in any way, in having the baby, conception. That's where the UTI affects, or the urinary tract infection. Then there is the reproductive system. And that system, it's the category of infections is called the sexually transmitted infections.
Okay.
Yeah. Then when an infection progresses high, into the reproductive system and goes into the pelvis, the pelvis. That's when it becomes the pelvic inflammatory disease. And some of the symptoms are you feel low abdominal pain. Yeah. You can even have a fever with low abdominal pain. It can start with a vaginal discharge. Yeah. Sexually transmitted doesn't mean that you're getting it. In most cases, people will think that maybe I've gotten it from my partner.
Yes.
Yeah. At times, an infection can start from the vagina or around that area, that environment, the way you wipe when you go to,
Number 2.
Yeah, number 2. So
sorry, you just explained something to me, that you can have an STD that is not sexual.
Yes. Okay. I understand the term, there is the word sexually transmitted, but an infection can start because they are down there. They are categorized as
Okay.
Yeah.
Okay.
But
sometimes
doesn't
it's not,
mean that you're getting it from the opposite partner. At times, some women are born. The way someone can be born without a hand. Yeah, they are called congenital anomalies or birth defects, whereby someone is missing the uterus. Yeah, we've seen a lady who, by 23, she had never seen her periods. When we examined her, we found she didn't have a uterus, she didn't have ovaries. Yeah, and she was looking like a lady. So, such things happen. Some people can be born with the cervix. The cervix is the gateway into the uterus and then the fallopian tubes. That's where the sperms enter. So the cervix can be stenosed or blocked, such that the sperms can't enter. Then there can be issues with the hormones. Hormones come from the brain, the pituitary gland and the hypothalamus. And they are the ones that stimulate the ovaries or cause the ovaries to mature follicles or eggs. So if there is an imbalance between the hormones that come above from the brain and those that come from the ovaries, if there is a mismatch called hormonal imbalance, such a woman can find issues conceiving. Then there are other conditions which can cause failure to conceive. One of them is polycystic ovarian syndrome. In such women, there is irregular menstrual periods. You find a woman menstruating once a year, menstruating after 2 months, 3 months.
You think that's a good thing,
I know,
right?
that's what exactly I was going to ask.
Yeah.
Sometimes
Such women you find them with some beards.
Okay.
Yes. Not every woman with a beard. Not every woman with a beard has.
And not every woman, because I don't get regular periods, but getting pregnant happens.
Easy.
Yeah. Regular.
Irregular.
Some women with irregular, what they call irregular is if your dates.
No, 2-3 months, easy, it comes, just like that.
Okay,
it has
fine.
always been like that.
Yeah, so such people, the problem is with ovulation, so they don't ovulate regularly. So if you're not ovulating, you can't become pregnant. So there are a number of there are so many conditions that would cause failure to conceive. In men, usually the problems are to do with the sperms. Yeah, there are men who have absent, like no sperms. You investigate them and you don't get any sperm cell. A man ejaculating doesn't mean, because they ejaculate and the sperms come from 2 different areas. Yeah, the sperms just mix with the semen. Yeah. The
Okay.
No, wait, doctor. You've talked of ejaculate. You've talked of the semen. You've talked of the sperm. Like some.
Okay.
Some of our might
I
not
understand.
get that one.
Yeah, there is the semen and then there is the sperm. The semen is the fluid that comes when a man ejaculates.
Okay.
Yeah, the ejaculate is the semen and
Okay.
all
Okay.
that. Yeah, so the sperm comes from the testicles.
Okay.
Then the semen comes from the prostate gland and the semen vesicle. So the sperms will come from the testicles and mix with the semen.
Semen.
Then
And
they,
then push out.
yeah.
Yes.
So in the event that the sperms can't, either they are not being formed by the factory, which is the testicles, yeah, the production is not there.
Yeah.
So the semen will come, empty void, you know,
Just.
just semen without
Okay.
sperms, can't make a baby.
okay.
Then at times there can be blockage along, you know, the tubes that bring up the semen to mix with this. I mean the sperms to mix with the semen. Yeah, in that event, still there won't be, you know, sperms in the semen.
Yeah.
Then also the sperms can be low. Yeah, not enough.
Yes.
Few.
Yeah, few. Yeah, there should be a specific number of sperms that reaches the egg for fertilization to take place. The journey, the sperms travel from where they are deposited to the point they meet the egg. It's a very long journey. And it's a journey of survival for the fetus. Yes. It's a journey of survival for the fetus. So many sperms die along the way. The weak ones will die along the way. That system, it's not a hollow, much as it's a hollow, you know, but it has bumps and, you know, the silicone. Yes.
Wow.
Yes.
Define our.
No, it's not a smooth ride. It's not a smooth ride. So many will die along the way.
Some will just get very fast, but go in other directions.
Yes. Then when they reach the egg, the egg is not something which is, you know, soft and, you know, there has to be a struggle. So they have to be a certain number of sperms that reach that egg for one to
Push
penetrate.
it inside.
Oh, so they all pull
Uh-huh.
Yeah,
And
then
once
one
one has entered, no other sperm can enter. There's-
that part
the
I knew,
egg.
but now that you've said, so they come
That's why they need their friends.
Yeah.
That's why.
Yeah.
Okay,
Yeah.
now
So the
I
egg.
Yeah.
Sorry.
But we've learned
But
from
he has
them.
explained in language.
everything else makes sense, but I was asking, why do you have to be so many? So they go knocking until one.
Yeah,
I've
so
understood.
one enters and then fertilization. And fertilization doesn't mean pregnancy.
Wait.
Yes.
Really?
Yes.
Fertilization takes place in the fallopian tube. So if there is a blockage, the sperm won't meet the egg.
Yes.
So after fertilization, it takes 3 days, about 3 days, for that embryo to move now back into the uterus.
Yes.
Then implantation and then pregnancy.
Yes.
Yeah, so low sperm count, sperm shape. You know, the sperms can be normal in number, the counts can be normal, but then the shape, morphology, what they call the morphology.
You're supposed to
big
be
head, very tiny head.
Okay, we shouldn't. Wow.
Yeah.
Big headed sperm.
Yeah. You know
That's how you get kids that are big headed.
no, please.
big head doesn't enter. It has to be arrow shape.
No, please. Yeah, so the sperm has a head and a tail.
Yes.
So some of the sperms may not have tails or short tails that they can't swim. So the quality of the sperm, the numbers, and then but there are also some men with who don't have testicles down there.
So they wait.
But
Yes.
doesn't your mom check that when you're born?
Yeah, it's some women don't get to know, others who deliver in the villages. That's why women should deliver in the hospitals. At least someone will check and examine. Yeah, some men have undescended testicles. So
Yes, I
or
think
one might go down and then the other one remains.
So when it remains up, it cannot do its job.
Yeah, that one. If it's not realized and put where it's supposed to be, when you're still a child,
Yes.
then if they realize after puberty, then it can't work. It's too late.
Now I want to know, what is the process of this diagnosis for you to find out that, wow, the problem I have is a big-headed sperm, and like take us through that diagnosis process.
Okay, thank you. Yeah, maybe to just a minute and I take you back among the causes.
Okay.
Yeah, when we get these couples, there is a section of infertility called the unexplained infertility, whereby you investigate a couple, but in a way you can't find anything, but they are not conceiving. Yeah, so there is a percentage of that part of infertility.
Oh, wow.
Yeah, so in the diagnosis of infertility, it's advisable that a woman comes with the husband to the hospital. They come as a couple. Yeah, when you meet a doctor, a fertility doctor, they will ask you, of course, history. How long have you taken? What have you done? How are your, sexual life? What have you done? Have you ever conceived before? Because there is primary infertility and there is secondary infertility. Primary infertility is if a woman has never conceived. Yeah, never conceived, never aborted. Yeah, she might have conceived, but maybe got a miscarriage. That's now not, that's secondary. If a woman has conceived before, even if it was for 2 weeks, then it's secondary. Yeah, so the doctor will ask those questions. Yeah, so then investigations will be carried out. Yeah, if we are looking at the reproductive system of a woman, we look at the uterus, the major things. We look at the uterus, we look at the fallopian tubes, and then we look at the system that drives that whole system, the hormonal system. Yeah, so the doctor will request for the blood test, the hormonal profile. That one we usually do when you're in your periods. They take off your blood on the second or third of your periods. So we look at the hormones that stimulate the ovaries and then those others that, act in that whole process. So we look at the levels. Then we'll do a scan. A scan will help us to look at your ovaries, whether they are active. There is a difference between ovaries of a woman who is still in the reproductive age bracket, where she's still getting periods and ovulating. Then with a woman who has hit menopause, those ovaries are usually quiet. Yeah, so you cannot see on a scan. Then in the uterus, you want to look at whether there are anomalies with the uterus. Some women have their uteruses divided into two, portions, what they call it biconjugate uterus.
Oh.
It has 2 horns. Yeah, and such uteruses women usually miscarry when they conceive, because now the area for where a baby has to grow from is small. Yeah, is small. So abnormalities with the uterus, fibroids. Yeah, fibroids. Yeah, also you want to rule out fibroids. Yeah, so a scan is key. Then also we'll do a test for the fallopian tubes called the hysterosalpingogram or HSG. Yeah, so that one the doctor will ask for an X-ray for your fallopian tubes, where we check whether they are open, whether they have other issues. Yeah, fallopian tubes can be open but still not able to work.
Wow.
Yeah, they can be open. Some people will come, open. My tubes are open, but that's not enough that your tubes are picking the eggs when you've ovulated. Yeah, ovulation is like you say mango tree, one mango will ripen at a time, then falls down, you pick it, take and eat. Yeah, so an egg has to come out, a fallopian tube has to pick it. Yeah, but in some women, especially those who have had pelvic inflammatory infections, they usually have scars inside there, that their fallopian tubes, their ability to pick eggs is limited. Like my hand,
Yeah, that makes sense.
Yeah, so if my hand is fixed like this, I can't move it. I can't do anything with it. Yeah, so some women have fallopian tubes like that. They are open, but in a way they can't pick eggs. And then HSGs also are not 100%, because for them, in most cases, they will tell us the fallopian tubes are open. Yeah, and then most doctors won't go ahead to analyze if there could be an external problem with the tubes. Yeah, so those are the 4 the tests we usually do for women. Then also for the men, of course, we do semen analysis. That's the major test we do. So in the semen analysis, we are interested in knowing about the number of sperms, about the viability of the sperms. Are they live? Are the most sperms live or dead.
Yeah.
Yeah, so then we look at the shape of the sperms, whether big-headed, small-headed, shorter tail, you know, all those details. Then you look at how the sperms swim. Yeah, there might be sperms, most of them live, but not able to swim, to have that progressive
Swim.
movement.
Wow.
Yeah, so we do all that. Then in the event we find there is no sperm, not a single sperm in the semen of a man. So we go ahead to now examine the testicles to see if they are there, you know. At times some men can have, you know, tumors in the testicles. There can be tumors that can block the flow of the sperms. So you can ask for scan. Then also we can do their also hormones. Yeah, at times some men, you've seen some men who look like females.
We've
their
seen
body.
them.
Yeah.
Yeah, such men like have higher female hormones.
Yeah.
Yes.
Higher female hormones compared, or have female hormones in higher quantities, so they make them to have a body like a woman's body. Such men might fail to you know, to make sperms. Yeah, other things also drugs. If there are some drugs that will cause someone either to lose sexual drive, like they don't meet regularly, you know, cause low sperm counts, you know. Yeah, such things. So all that comes out.
Okay. In light with that same question on the diagnosis process, I would like to ask, I've heard before that sometimes the problem can be not with the man or the woman, but with the meeting of the two. Like I have a friend for whom they were saying, no, you see, the problem is every time your man's sperms enter you, it's like they burn the sperm, they kill the sperm. How true is a statement like that, and if indeed it's true, is that something you can diagnose? But then also, secondly, every test you've said for the man, you need to be having an ejaculate, so an active ejaculate. By the time you're saying you want to see how it swims, how does this process of getting that ejaculate, like does he have to ejaculate from the hospital, or is he allowed to go and ejaculate from home, then bring his sperm? Like how does that work? Allow me to ask my question. Okay. Yeah. I want to know.
Thank you.
I've had that first question of yours. They say compatibility, that they are not compatible.
Yes. How would you test that if indeed it's true?
Okay, there are some women who their cervix, or they produce a fluid that in a way kills the sperms. Their secretions in the birth canal or in the reproductive canal can't allow sperms to be alive, to stay alive. Yeah, they usually contain antibodies. Antibodies are like proteins that will attack the sperms. They will recognize the sperms as something foreign and fights them off. Yeah,
so all men or just a particular person?
That usually happens in women, some women.
Like, are they fighting the sperm of all men or that particular man?
Yeah, it can be all men.
Wow.
Yeah, it can
or a
be
particular person?
It can be all men. Because those proteins are in a woman, and they fight they fight sperms. So sperms can't cross. Wow. And it's usually those secretions are usually within the cervix, the cervical canal. Yeah, so such happen.
Okay.
Then the way we get the sperm, the semen from men, in the hospital, we give them containers, so they give us the semen. There are two ways of getting the semen for us. One is masturbation. They go, we direct them somewhere, they go. Within minutes, they've gotten the sample. Some men who are not comfortable with masturbation, that's the easiest way of getting the semen, will go with their partners. Or we tell them to get it from home if there is tenure. Yeah, usually we allow 1 hour after you've collected. We allow 1 hour to return to bring the sample to the hospital.
My question is about natural remedies and treatment options.
Okay, thank you. About the natural remedies, so after we've investigated Because by the time a woman comes to a doctor, they want to conceive. They want a child. They've maybe waited for some time. So by that time they approach you as a doctor, they want this baby like soon. Yeah, so some natural remedies can take some time. And we would advise about the natural remedies after we've investigated you as a couple and we've seen everything is still okay. Maybe you're still within the allowable time. Yeah, maybe within a year. Some people are impatient. After a month, they will come to you. we got married from honeymoon. Yes, from honeymoon, nothing happened. They will come to you. So such people, you can advise them. Yeah, you go if maybe you see they're a bit overweight or, you know, obese, they will tell them about weight loss, you know, lifestyle change, exercise, about the foods, you know, reduce on the carbs, you know. If they are smoking, stop smoking, reduce on that. Yeah, some I would advise detox. You've heard about that term, detox. Yeah, to do detox programs. Yeah. So some come back when they've conceived. Yeah. So about other treatment options, we offer. So for people we investigate and we see the fallopian tubes are still redeemable, they can be corrected, we can advise a surgery called laparoscopy. It's a keyhole surgery. We use a camera, we go in, look at the fallopian tubes. If we find this fallopian tube is open, maybe it has limitations on the outside, adhesions, things attaching to it that limit the movement of the fallopian tube to the ability to pick the eggs. We'd, you know, cut that off and it's free again. It can pick the eggs, or they can pick the eggs again. So that operation, some people conceive after. Yeah. Then for couples where we don't find really a particular cause, that unexplained infertility, we advise we do what they call ovarian stimulation, or people who don't ovulate. We put them on medicines that will stimulate their ovaries to mature like 1 or 2 or 3 eggs at a go.
That's how they get the treatment.
Yeah. So we give them an injection that will cause them to ovulate. Yeah. It's like if you have ripe mangoes on a tree, you climb and shake.
Come on.
Yeah, so that they can drop. Yeah, so we give that injection that will shake the tree. That will cause them to ovulate. So, so some conceive. Yeah, so for people where you expect, you know, that thick, some women produce what they call a thick cervical mucus that can't allow sperms to pass that barrier. Yeah, so there we use a small pipe, catheter. It's called a catheter, a small tube. So we get we first of all prepare the lady. We make sure there is an egg that is ready for fertilization. Then we get a man's sperm, concentrate the normal ones very, very nicely, then put them in a tube. We bypass the cervix. Then we drop the sperms deep near the egg, so they travel a shorter distance. That one we also do for men who have relatively low sperm count. Yeah. If we see the numbers are workable, we can work with them in that regard. So we do insemination. It's called insemination, or IUI. Intrauterine insemination. You inseminate the sperms into the uterus.
You help them to run some distance.
So you
marathon.
You make the
You assist.
Yeah, you assist them to
relay. They're in a relay race.
So you put them near the eggs. Then they move, meet the eggs, fertilize. Then woman becomes pregnant. Yeah, where everything has failed, then the last resort is IVF. The in vitro fertilization.
IVF is a last resort.
That's the last resort.
It's like the last resort. If we see maybe you've tried these other first line, we call them first line treatments, and they are usually cheaper, first line treatments. Then we recommend IVF. Or couples who have tried, like waited for 10 years. The luxury of trying these other ones. Of all the options, IVF offers the better chances. So couples who have waited for so long, or you say woman is above 35, they need a child as soon as yesterday. So such couples, IVF is the best. Is the best treatment option. I mean.
Okay, doctor.
Yeah.
So with all the treatment options I've had, you say, like there are really many. I think I've had about 5. How expensive are they, or how affordable can they be for a normal average woman?
Yeah, so treatment, as I've said, depends on the age of a woman. Yeah, so it basically depends on how much of the drugs you're going to consume. If they are young ladies, the doses are usually, low, so that means cheaper. Yeah, but these other treatment options, like that timely sexual intercourse, whereby we just prepare the egg, then when the egg is ready, we tell you that within this period, you go be together. That's the first line. Yeah, we call it TSI, timely sexual intercourse. That's when you have sex as medicine.
Timely.
On time. Do not
it's cheap. It's cheap. At times a woman will just very what?
Stressful.
Yeah, all the fertility treatments are. Yeah, depending on how eager you want to have this baby.
Of course.
Yeah, some women, of course, will go through these treatments smoothly. Others, they're on pressure. They're on pressure from friends, from family, from the man is going to leave me,
Yes.
If there is such, then that woman can even break down.
Yes.
Yeah, so with that TSI program or the timely sexual intercourse program, it can cost less than $1 million, less than 500,000.
Okay.
Yeah, then the IUI, the insemination, can cost between 2 million and up to 6 million. Depends, just as I've said, depends. Even IVF depends on the age. Yeah, depends on the age and what medicines you're going to consume. Yeah, but it usually goes from as low as 2 million to as high as over 20 million. About the emotional support, from the time a couple walks in to us, and we are going to offer a particular treatment, because none of these treatments are 100%, is 100%. Nothing is sure deal. So we tell them the chances. With IVF chances, success rate is about 40 to 70%, meaning out of 10 women, 4 to 7 will become pregnant. Yeah, so even the rest, nothing is 100%. Yeah, so we start to prepare these people from the word go. Even before, if let's say we are going to do IVF, because we do IVF on a group, so we put them together. They ask questions, we answer the questions. We offer counseling. We tell them what the expectations, so that someone doesn't, high hopes.
You manage expectations.
But some people will put their trust in what they've paid. Someone will get their money paid and they think, it's done.
I want value for my money.
I'm walking out with a baby. Yeah, that's not the case. So we tell these people. But once your expectations are really high, trust me, at the end of the day, you're either going to be very excited or
very crushed,
very disappointed. So those are the people you find, wailing. Yeah, and when it comes, some women, of course, they will go take a cologne, because maybe this is my thing. The man has his kids, the man will only offer the sperm. Some men will even refuse to offer the sperms, So you find this woman, the loan, he's going to pay the loan in 5 years. So when it doesn't work, yeah, so we tell people not to take loans for this treatment, but of course someone won't tell you. Some people will even sell their property, but of course they won't tell you. It's after it has failed and then you hear them cry, I sold my house, what, such things. But for anyone seeking for this treatment, they shouldn't do that. Yeah, they shouldn't do that.
Doctor, what has the government done, or what more can they do to provide specialized fertility care for Ugandans? Have they done anything to help in that sector?
Well, I won't speak for the government, but I know something. Yeah, at least the government is at least doing something. Before, infertility wasn't a major issue, but in the last 5-10 years, yeah, the awareness is more, and you know, more people are coming up. You know, there are even some organizations which are coming up to talk for and such programs which are very good. Yeah, you people are doing a great job. Yeah, so yeah, in 2018 there was a symposium that was bringing together fertility societies from across the world. It took place at Serena, and I saw the minister taking, you know, picking, you know, an interest in this topic, and the way she was talking, yeah, it showed that the government is cooking up something. And yeah, we've seen Mulago Women's Hospital, the maternal and child that fertility. Yeah, it's very beautiful. Yeah, here they are going to start fertility treatments if they've not started. Amazing. Yeah, which is believed that it's going to be a bit cheaper.
Okay.
We'll wait and see. Yeah, but I think the government also needs to do more, especially in this area of awareness. Okay. You saw how the government came up on AIDS before AIDS was thought of as a curse, you know. People used to stay in bedrooms, not come out.
That's true.
Yeah, but the energy the government put in AIDS now, even, you know.
Like it's a normal thing now. You announce it publicly.
So even for infertility, because infertility is just like someone, you know, is battling a cancer, or much as it's not, you know, it won't show on the physical, but these people, you find someone who is stressed, they've, you know, lost interest in everything, depressed. So people are suffering. Yeah, this thing needs to be tackled. So the government needs to put in the same energy as it put in battling AIDS. Yeah, so the awareness needs to be, you know, more. Yeah, more people, you know, the mentality of it's a curse, on yandoga, mama, my stepmother, yankola, you know, those things. Yeah, so because that used to be the mentality with AIDS also. Yeah. So,
wow, doctor, thank you so much. This has been really informative. It has been insightful. We are glad you joined us today.
Thank you.
Thank you so much. Do you have any experiences, any unanswered questions? Dr. Joseph of Women's Hospital Bukoto will be here to answer all those questions on our platforms, our Facebook and Twitter. With love from Bump Love.